Example of the isotropic 1 mm contrast-enhanced T1 wide MRI sequence of the brain. This sequence is routinely used to highlight the lesions of blood-brain barrier disruption, such as different tumors, acute inflammatory lesions, etc. One could easily rotate all the scan volume and cut the region of interest using slicer tool. The same sequence is post-processed in volume rendering tool. On the maximum intensity projection, MIP, reconstruction contrast media inside the vessels as well as the areas of contrast uptake are seen bright. It is extremely useful tool to assess general vessel anatomy and relationship between contrast-enhanced areas and large vessels. Non-contrast-enhanced time-of-flight magnetic resonance arteriography is the best pulse sequence to assess arterial vessels of the brain, so-called circle of Willis, and exclude its aneurysms. High spatial resolution, about 0.6 mm, and shaded surface display, SSD, post-processing allow accurate delineation and visual separation of vascular structures from other brain tissues.
Isotropic 3D FLAIR sequence uses special pulses to suppress the signal of cerebrospinal fluid. On that program, most of the brain lesions appear brighter than parenchyma. This is the example of Alzheimer's disease and amyloid angiopathy with moderate brain atrophy and lots of periventricular and deep white matter lesions.
The distribution of the lesions and its location in the brain are clearly seen in volume rendering mode using maximum intensity projection, MIP, with different window level and width. Fat-suppressed proton density sequence is a gold standard of joint diagnosis in MRI. Combining 3D approach and high spatial resolution, 0.7 mm, provide accurate visualization of all anatomical structures and their lesions. Ruler tool allows precise measurements of structures of interest in 3D volume in an easy way. If the structure has an unusual shape, the polygonal ruler is also available. The development of MRI has led to the routine use of 3D sequences for imaging not only the brain and joints, but also the pelvic organs. This is an example of a fat-suppressed T1 weighted gradient echo 3D sequence after contrast enhancement in a patient with ovarian dysdramonoma. Using Bodyscope software in virtual reality allows not only to evaluate the data slice by slice, as in a professional 2D DICOM viewer, but also to easily perform oblique reconstructions in any angle with just one movement of the hand. The use of different presets and width/level of the visualization window provides a volumetric display of contrasting structures such as the tumor, uterine layers, vessels and nerves to assess their spatial location, which is important for planning possible upcoming interventions such as biopsy or surgery. The main anatomical program for pelvic MRI is the T2 weighted sequence, which is often scanned in 2D mode. In our case, a high-resolution 3D approach was used to accurately diagnose the tumor spread and assess the anatomy of other pelvic organs and structures. An example of a computed tomography, CT, of a patient with right upper lobe lung cancer. Thin-section pulmonary reconstruction can be assessed in the scanned axial plane using just one smooth joystick movement. In addition, evaluation in other planes can be performed by simply rotating the volume by hand at the desired angle, which is much faster and more convenient than using the mouse and various buttons in a conventional viewer.
A combination of various presets, visualization windows and multiplanar reconstruction provide a clear and understandable display of the tumor in the body volume. This approach allows not only to help the surgeon to plan any upcoming interventions, but also to clearly show the pathological process to the patient. Moreover, the ability to jointly view the study in Bodyscope ensures confidentiality and complies with the principles of today's personalized medicine.